And you're good to go.
Hi, my name is Dr. Babette Sines, and I am today going to teach you a little bit about muscle isolation technique. And the protocol that I'm going to go through today is called...
Oh, let's stop for a second. All right.
No, not yet.
Ready? 3, 2, 1, go.
Okay.
I'm Babette. How are you?
I'm well, thanks. How are you? I'm Rachel.
So, tell me what you're feeling in your jaw.
Jaw pain here, it pops, and then it's not as bad on this side, but it's here. I mean, I think that Dr. Kathy, yeah, has she's worked on it, so it's not grinding as much, but now it pops,
Okay.
and so it's been for everything.
Okay. What is your
She's gotten
pain
through.
level?
Today it's not so bad. It's about 7, which is, I mean, it's been worse.
And how long have you had this?
Oh, probably years, but it's just been progressively worse the
Okay.
last maybe year.
Okay.
Yeah.
So what I'm going to do is twofold. I'm going to do an external exam
Okay.
to see what's going on, and then I'm going to do an intraoral treatment. So this is called a neuromuscle isolation therapy. And I go in and release attachments and insertions of each of the muscles in your jaw. And when you're done, you're going to feel like $1,000,000.
Oh.
So we release in the process, we do a release of the cervical spine, the clavicle, and the neck muscles, because they're all attached.
Yes.
So what we find is that if your jaw is not placed properly, if it's out, it will affect your neck because your head's not sitting on those 2 little bones properly, and it can affect your entire spine. So you can have low back pain, your hips will be canted, it affects everything.
Yes.
So, with your permission, we'll go ahead and get started. Is
Yes.
that okay with you? All right.
3, 2, 1, and go.
Thank you. Okay, so I'm just going to feel, I want you to open your jaw, close it slowly, again, again. Oh man, yeah. Open it again.
Yeah, I can feel it now.
Okay.
Doing pressure.
All right, you have neck pain too?
Mm-hmm.
Okay.
I have everything pink.
In here? Yeah. Okay, yeah, I can feel that.
Extension.
Okay, so I'm going to pull the table up just a little bit, okay? I'm short.
Okay. I was gonna say, do I need to get off? Are you gonna drop me?
Sorry, Paul.
No, you're good.
Okay. Which side hurts worse?
This side.
Okay.
Yeah.
Chances are this is the side that is out.
And I felt it now that you were touching me.
So we're going to start on this side, and here's how I'm going to do this. I'm going to go inside on the very top of your teeth, and I'm going to slide my finger along the top until I find the muscle I'm looking for.
Okay.
I will apply gentle pressure, and sometimes when it's really painful on this side, you don't feel it on this side.
Okay.
But when I get over here, it may be a little more painful, okay?
Okay.
So I'm going to have you just breathe through it.
Okay.
The other thing is there's a lot of emotion held in the jaw. So if you start to tear up, just remember that that's what you're releasing is toxics from
Okay.
this, okay? All right, so if you don't mind, open your jaw. There you go. We're going to just come in and find the muscle. There it is, right here. Sometimes it's a little pinchy, sometimes it's not. Okay, I'm just going to slide my finger across and I'm going to massage this muscle. Oh, that's nice and tight. Okay, close gently. There we go. Now, the temporal muscle is up in this area, and we're just going to apply a little bit of gentle pressure up in here. And it's usually painful, so you want to watch the patient's face to make sure that you're not applying too much pressure. You okay with that? Okay, we're going to just slide out. And as you're sliding out, you're going to want to just apply gentle pressure on the outside to feel. There is a trigger point on the inside of the cheek here, and that can be very, very tender. On me, it gets excruciating, so when they do that to me, it's like, ah! Okay, one more time on the top. You okay with that pressure? Actually, it's not too bad. I'm going to slide in. We're going to apply a little more massage in here. Close a little bit. There we go. There we go. We're just going to massage a little more. Feel that releasing? Yeah, good job. As you touch these little muscles, the muscles in your body in general want to let go. Close good. Excellent. Okay, don't grind it. Don't clench. Once you give the muscle permission to let go, it does. Okay. You all right?
I am.
Okay, now we're going to go on the bottom and find it the same way. There's a little muscle back there I want to get to, okay? And this one kind of feels like a little pinprick. To me.
Oh.
When they do that to me, it just, okay, close. I'm going to get in here and I'm just going to apply a little pressure towards the outside. So, in essence, you're pinching, holding on the outside, and applying a little pressure. Is that okay? Doesn't hurt? Good.
No.
But it's not bad. Excellent. Okay, I'm just going to move up again. Apply a little more pressure this time. There we go. Excellent. Okay, how do you feel? Not bad?
No, I'm good.
Now we're going to go in under the tongue and release the digastric muscles, okay? Both in the external and internal. And these can be very tender. Yeah. Oh, beautiful. Okay. You all right?
Okay. Yeah.
Okay. All right,
I have a
now we're
very
going to
high
go on the other
tolerance for
side.
pain.
Like spasms in his entire neck, shoulders, all the way down his spine. And he had had it for 20 years. This pain was so bad he was on major meds. When the girl that taught me finished with him, it took 3 treatments. The first one, he cried through the whole thing. It was so painful. The second one,
Yeah,
he walked in,
that's
he was like,
that,
he knows this
Linda that she
doesn't
was
hurt as
talking
bad.
about.
By the
And-
3rd treatment, when he walked in, he goes, I feel like a rabbit.
Yeah.
He
and,
said, my teeth in
she's
the
a
back aren't
PMJ.
touching anymore, only the front ones, because he'd ground him down so bad to try to make him fit. So once that rectified, he had no more pain. And now he goes about once a month.
Wow, that's
So-
good.
So, Dr. Babette, when do you want to take one of us? Like, Kathy can go first. When you're going to train her, do you want to do this first and then redo it again with Kathy?
Oh,
Oh
absolutely.
no, I don't want to be on that though.
No, you won't be on that.
But we also, it would be good to
I know.
have a patient that is for us. So maybe on mine you can practice, okay?
Okay. All right.
All right, let's get going
Can
here.
we see from there? Sue?
Is this more tender?
Oh,
Not too bad. Okay, I'm going to slide my finger in. Yeah, this is going to be a little more tender here.
And what are you doing right now, Dr. Babette?
So I am massaging the muscle inside. There's a tendon actually, and then I'm applying pressure to the temporal muscle. Oh, this trigger point is active. I can feel
yeah,
it.
it
Did it
hurts.
hurt? Yeah, I'm so sorry.
That's okay.
We'll try it one more time. So when the cheek trigger point is active, it feels like a big button, and it's painful. Okay, let's try this again. Close a little bit. Let's get in here. You can actually feel where it's out. So if you apply a little bit of pressure, sometimes it'll just pop back in where it's supposed to be. Sometimes it takes the 2nd treatment or the 3rd treatment before you can get that to happen. I can feel this muscle in here trembling. It's like quivering, like trying to let go. I'm sorry, honey. Yeah, this is tender. Sometimes you can grab the temporal muscle and just shorten it, and it doesn't hurt as bad. Okay, I'm so sorry.
It's okay.
Okay.
That makes me feel better.
It will.
Yeah.
Okay, I'm going to go in on the bottom now, okay? Oh boy, this one is going to be a good one to release. You can feel the muscle feels like a little bulge under your finger, and you just apply gentle pressure. The one on the bottom can feel like a pinprick when you get right on it. To the patient, it feels like a pinprick. To you, it feels like a little bulge, and it'll soften up under your finger, and then you can move, slide it over, massage, close a little bit. There you go. It makes it a little easier. But this, she's got the masseter muscle and the buccinator in the back that are like little rocks. So we're going to do this pass probably 3 times to make sure that she's getting what she needs out of it. And this is like loosening up here too. So as we loosen up these muscles, the trigger point softens. It's not as bulging like a little button. Okay? Let's go in one more time. Okay. And for people like you, Paul, who have such large hands, it's going to be critical that you go in carefully because your fingers alone are going to create pain. So for these guys that have such little fingers, little hands, it's not going to be as difficult. But I was thinking about that yesterday. I was like, man, do I want them in my mouth? Okay, we're going to go under the tongue. And you apply gentle pressure, come up under the jaw because that's where the the digastrics lie. And this side has already loosened up quite a bit. Good. Okay. Now instead of coming out, you're going to go to the top. You know that little point that calms a person down? You're going to just massage that for a moment, and then you're going to go straight back and feel the palate. And you're going to feel a difference from one side to the other so you can tell what side you need to be on to massage in, because the sacral, craniosacral moves that we know how to do are also in the mouth. So just gentle pressure and massage will move those bones. It'll help her breathe better. And see, so this side feels like it's congested up. So I'm just going to massage the area a little bit more. Okay, and then you're going to come up, put both fingers in, and you're going to grab the top, push up, push back, push forward. And then just come up and grab that little point there, and you're done. That's the intraoral. The rest of it is different. It's not in the mouth, but it's just as important. So, one of the things that we want to feel, and she has her atlas out, and I don't have Thumper with me, my mom's bringing it. So, the atlas is usually the biggest culprit of jaw pain. Or it's C2, so it's the axis. The C2 is that little tiny bone that will move on its own. So it doesn't have any other vertebrae attachments to it, so it can go all over the place. Have you ever had a car accident?
Yes.
Okay, so whiplash?
Yes, years ago I was treated.
So I'm going to have you guys come and feel the difference between these two, right at Sundial 17 behind the ear, right at that little junction. You're going to feel, and I'll let you tell me which side is a little out.
She's my patient. I feel all the time.
Yeah. And today we're going to do, on her, we're going to do angel wings because it's part of the treatment.
So I'm
right back here.
looking.
From side, you can compare the two sides.
Should I put pressure or
A
just-
little bit of pressure.
I'm not sure what I'm feeling for, but
I'll show you. I want you to put your fingers right on mine.
okay, thank you. That'll help.
Right in there.
Okay.
Did you have a car accident?
No,
Any kind of accident?
not that
Did you grind your teeth
I
as
grind.
a child?
still
Okay.
and clench
Okay.
chronic. It was to the point where I could barely open my mouth, and Dr. Paul did one treatment of acupuncture, and I can open my mouth,
Wow.
but it still hurts,
Mhm.
and I get the pain up into the
Sure.
temple.
Okay.
I hear Dr. Paul's pretty good.
Very good.
Sorry. I just had to go with that. It was perfect.
Okay. So, Dr. Suzanne is going to start by. You want to watch
I'm going
again,
to follow.
or do
Can
you
I
want
tell
to?
her what I'm going to do?
Yes,
I think
please.
I'm ready. I'm just going to insert my index finger, follow your teeth line to the back until I find where the insertion muscle is,
Okay.
and I'm going to massage that a little bit. That's how I'm going to start,
Okay.
and that's as far as I can define.
Yes, and
Dr.
that's step
Babbitt's going
one.
to describe
Okay, so
the
that's
steps.
step one.
So step one is to find that temporal muscle, or the insertion of the muscle. So she's going to follow the tooth line, find it. It feels like a little nodule on the backside of the teeth. And she's going to gently apply pressure. And she's going to slide that finger over onto the other side of the cheek and massage that insertion there.
Okay.
So the muscles and tendons that are in here are the ones that she's going to work on inside. And she's going to slide her finger up into the temporal muscle, which is up in here. Do you have sinus problems? No?
No.
So that probably won't hurt her.
Okay.
Okay, go
So are
ahead.
we ready? Go ahead and
Mhm.
open your mouth. So I just start right here and follow all the way side.
So it appears she's following the top teeth down to the back, right?
Right
Don't
there.
go too far back.
Is that it? I mean,
I don't know.
do you have pressure there?
Mm-hmm.
I feel a little bead.
That's it.
So I'm just going to massage that lightly.
Mhm, just lightly. You'll feel it start to melt under your fingertip. Okay.
Already.
And now you're going to
It's
just
still there a
slide your
little
finger in the inside of the teeth. There you go.
This way.
And massage right inside. You're going to go
Wow.
this way,
Straight down.
straight down, and massage that area.
And I feel a lot of
Tension.
nodules, little
Okay.
tightness, a lot of
Mhm.
tension right there. Do you feel that tension that I'm feeling?
That's good. And
And
then
I feel the
slide
muscle
it
move.
up. And close your jaw just a little. There you go.
Now I slide up and stay as close to the mouth. Okay.
Yeah, you're going to get to right here. There you
Yeah.
go.
There it is.
And you're just going to put a little bit of pressure on it and hold it. Is it tender?
Mm-hmm.
Yeah. So I got the right spot then, right?
And if it's too difficult, you want to back off and just let them.
Because her eyes look pained.
Mhm. I always watch the patient to see that they're comfortable because this is a very painful treatment for some. And you don't want to get bit.
And I'm just looking for softness now.
Mhm.
After it was hard, I'm looking
And
for
it's not going to
softness.
happen immediately. So
Right.
you're going to come out, grab the cheek, massage it a little bit on your way
Like
out,
this.
and just come out. There you go.
Some tension here. I mean, unless that's just typical mouth. Sorry.
Mm-hmm.
Okay.
Okay, you're going to do that
Okay.
same thing one more
On-
time. So you're
on
going to
the
make
same.
2 passes.
Okay.
How do you know when you need to make more passes?
You usually won't. If you have to, it can create soreness. If a patient is willing and they're in excruciating pain and it's making them feel better, you can do another pass.
So I think I'm ready to move. It feels different. I just don't know to what extent, but it does
Okay,
feel different.
Now, you're going to go close a little bit. You're going to create a space here
Okay.
and go
Okay.
into that, deeper into the joint.
Okay.
Can you
Wow.
feel the joint?
I just sunk in there.
Good. That's what you want. Excellent.
Yes, I can feel the joint.
Okay, now you're going to come back up to that one. Gently apply pressure. Does it feel like it released?
Right here. I'm
Okay.
sorry, I'm sorry.
All right, and now just swipe out and you're good. Now you're going to do the bottom.
Bottom.
And
So
you're
I'm going
going
to follow the same line
Mhm.
inside the teeth line.
Exactly. Step 2 is the bottom. So open
Am I going to feel the same nodule? I should
Always
go down.
start-
Start at the front, yeah.
and slide. And you're going to go right
To
to the
the
back.
back of
You'll
the
feel,
teeth.
to them, it might feel like a little pinprick. To you, it's just going to feel like a soft spot or a little nodule. On Linda, it felt like a,
Right there, I feel it now. Do you
Right.
feel a pinprick?
Like a little bump.
okay.
Yeah, I have
And
the
now you're
bump.
going to slide across. You're not going to spend too much time
On that
with
one.
pressure. You just want to slide across the same way you did.
The way I came in?
No,
What do
the
you,
same way you
outside.
did.
Okay,
There,
gotcha.
and then dig in again.
Okay, gotcha.
Oh,
That one's getting you, huh?
okay.
Am I too?
Down in here.
Also, stay there.
Stay
Okay.
there. And because what you're doing is you're releasing the
Yeah,
joint.
and I can feel that,
Mhm.
but I.
And if you need more space between, close your
Uh-huh.
mouth a little bit.
Okay.
And I want you to apply pressure to it and see what that feels like. Can you get
Yeah,
in there
I
enough?
feel I feel a crevice.
Okay, good. That's
And-
what you want to feel.
Yeah, I feel the crevice.
Good.
So that's the jawbone.
Mm-hmm.
Are you okay?
Tender.
And then, so should I pull out
So
or
you want to
just
just
let it
apply
kind of,
a little bit of
Okay.
pressure.
just
not
to
a
help
lot.
release?
Mhm.
Okay. Am I too rough?
Mm-mm.
Okay.
Good job.
It feels better when I go like this. So that just I can feel it relaxing it.
Mm-hmm. Perfect. Okay, don't spend too much time. Just
then-
come out.
Come out.
There you go.
Okay.
Now, I'm going to do this on you
Okay.
next because I want you to feel what it feels like.
I would love that. Memory.
Okay.
Muscle memory.
Mhm. Okay, so one more pass along the bottom.
Okay. So,
So you do 2 passes on the top, 2 passes on the bottom. And you'll feel it change after the first pass.
it's already kind of filled up a little bit. Is that what I would expect?
Mhm,
The crevice isn't as deep.
Yeah.
And then just relax the jawline a little bit again.
And you ask her
here.
to close a little.
Okay.
That
That
way
helps
you can
me,
feel in.
yeah.
Mhm. That way you can get a little deeper down into the joint. Okay.
Interesting. And then I can pull.
And then just pull out. Now on this side, you're going to go into the digastric. So you're going to go the first time right under the tongue on this side, and it won't go very deep. And you're going to come out and push in on the other side of the digastrics.
Oh, I see.
Okay,
Okay, that
so
rocking
open.
feeling. So I can use
Mhm.
the other hand.
Yes.
So I'm just going to slide in.
And
like
actually,
this.
you're always going to want to use the same hand on the
Okay.
same side.
So can I then?
Yes.
Because that didn't feel right to change.
And go on that side only. Because you're going to do this side separately.
Okay. So then here I'm just
You're
rocking.
going to go, no, you're going to go a little down,
Okay.
push in, come out mostly, ease the pressure in the mouth,
Okay.
and come
then
in
from
here.
Oh, so I'm actually moving the jaw.
Yes.
She's tight.
Yeah.
So should I ask her to relax it? Because she's really holding on tight. Do you feel you are? Okay. So I'm going to go down and
Mhm.
up.
And now go farther that side,
Down again.
like,
I don't know what to do with those other fingers.
okay, right in here.
Okay. Okay. Got it.
Okay.
Oh.
So,
And then
and
I
it'll
can,
go deeper.
Yeah, I can
Okay.
go pretty far.
And now you're going to come on this side
And like
and just
sorry.
release from there. And you don't want to go too hard because you've
Okay.
got all kinds of stuff on the neck,
she could-
right?
yeah.
And that's it. You go two
That's-
times. That's it.
That's it. Okay,
Mhm.
so 2 times.
Mhm.
Okay.
All right?
That was a little bit awkward.
Yeah, that
I
It
mean,
is
it's
the
hard.
first
That's
time.
a feel
Mhm.
weird.
But you're going to want to get used to
Yeah.
using one hand on
Okay,
one
gotcha.
side, the other
That
hand on the
makes
other
sense.
side.
It felt weird when I tried to do that.
Mhm. Because
Okay.
I know you're right-handed or you're left-handed.
Mhm.
You can't use your dominant hand
So you just
for
have to be
this treatment. You have to, yeah, you have to. So I'm going to
Okay.
come in on this side, okay?
So Describe the step. Give me 1, 2, 3. Go.
Okay, step 1, I'm sliding along the top teeth until I find the little nodule at the back of the teeth, which is a muscle attachment. Is it tender? Mm-hmm. Yeah. So I'm just applying gentle pressure. If it's too tender, I back off. Okay? Because you're going to come back to it anyway. Now close a little bit. Oh, man. Oh, ho, ho, ho. This, I felt it click as she tried to close it. So that tells me I'm just going to feel that joint a little bit in here. And that joint is like a rock and it's not in place. So I'm going to come up this side. This
Shorten
temporal
it, too.
is really tight. I'm just going to shorten it so it's not as tender. And we're going to come out.
Now, how do you know when to shorten that?
When she goes,
Okay.
when the patient is in pain and you know you got to get in there, you shorten the muscle a little bit and it doesn't hurt as bad. Ready?
Mm-hmm.
One more pass on the top. Good. Excellent. Okay, we're going to come over here, relax a little bit. Oh, there we go. Now I am getting deeper into the joint. Is it painful, hon?
Not at all.
Not enough to make you cry, though, so I'm going to just keep going, okay? So I'm applying pressure on the joint itself back here because I want it to move. It is so if the joint is supposed to be even like this, hers is a little off.
So you feel it off.
Yeah, you can feel it from the top.
Could I have felt that over here?
If it's off on that side, yeah, definitely.
I felt like they were aligned. I
Okay.
felt like when I went like this, I could
It was
go
good?
like that.
This one is not happy. You okay with that pressure? Okay. I'm going to go on the bottom this time.
Step 2.
Step 2, the bottom, till we find that little nodule. Feels like a pinprick to me, but when they do it on me, but sometimes it doesn't have any feeling and sometimes it just hurts. So we're going to keep going. Ready? Close a little bit. Let me get in.
There's a little pin light.
Oh, this is great. Do you feel the relaxing coming? So as the patient can feel it, I know I can feel it, but as you ask them, are you feeling this relax? They know. Yeah, this is definitely relaxing. Okay, we're going to come up one more time up here. Good. You all right?
Mm-hmm.
Okay, one more time. The bottom. We're going to make a pass. You're going to close a little bit as I go in. Close a little more. There we go. Good job. That's much better. Okay, now we're going to go into the digastrics.
And this is step 3?
This is step 3.
Step 3. Thank you.
Okay. Now we're going to do the top. You want to do this part?
Yeah, I would love to.
Okay.
And this is step 4?
This is the last part.
Step 4.
Step 4. Okay.
So I start with the massage. That
Start
little
with massage right behind the teeth.
Right in here.
And you want to go a little bit heavier than
Okay.
normal because it lowers their heart rate, it soothes their breathing, it calms the shin, so to speak.
And I move it. I don't just press.
Right.
Okay.
Because it's a massage.
Yeah.
And then you're going to go straight back on the palate.
With one finger.
Mm-hmm.
Okay.
And you're just going to slide it side to side so you can feel the differences. And you'll feel which side is different. Sometimes you don't have any differences.
I'm not feeling too much of a difference. I feel a little more roughness on one side, I think.
Okay,
Is
smooth
that
it
normal?
out. Just massage it.
Okay.
Use your instincts
Mm-hmm.
to deal with what you're feeling.
Are you okay?
All right. That's plenty of time in her mouth.
Okay.
So now you're going to get your teeth.
And I'm going to follow the teeth line, right?
Teeth line right on top of the teeth.
Okay, all the way.
And you're going to get them here.
Oh, yeah.
Push this way. Push that way. And up. And now up. There you go. And then you're going to grab the front with two. There you go.
And then massage right here.
Yeah,
Just-
don't even massage, just pull.
Okay.
Pull. And that's
Touch
it.
and pull. Okay.
The rest
How'd
of it
that
has
feel?
more to do with the neck.
Good.
She liked
Did
that.
it, what did it feel like, Cindy?
A lot of pressure, a
Lot
little
of pressure.
pain,
Yeah.
How does your
but
jaw feel?
it feels lighter.
Lighter.
That
Good.
explains it.
Yeah.
Lighter.
Yeah.
It doesn't
Wonderful.
feel as tight.
Yeah.
Mm-hmm.
That's
It feels
fascinating.
good.